Good evening. Assalamu alaikum. I apologize for the delay. I got stuck in traffic on this road. And so let's start without wasting any further time. We have this topic, as you know, is understanding societal failure in providing clean drinking water. Yoda sophisticated kisanga title, but basically the thing is how do we get clean drinking water to a public? And we have three speakers. Dr. Syed M. Hassan. He is going to give us a background on what is this failure and issues, what are the issues. And then we have Dr. Tahir Majid, who will talk about what the Punjab government initiatives are, how much success they have had so far, and what are the potential and future plans. And not Tahir Majid, I think I was told that, is that correct? Yeah. Okay, you changed this thing. I was told that there had been some change. And then Hamad Naki Khan, who will be the Worldwide Fund, will tell us about community and society issues. Is that right? I think. So, so let me just introduce Dr. Hassan. He is currently an assistant professor in economics at the Lahore University of Management Sciences and a faculty associate of the Center for Water Informatics and Technology at the Lahore University of Management Sciences. He is a former civil servant at the Federal Board of Revenue and has a PhD in agricultural, environmental and development economics from Ohio State University. Thank you. So I'll just request Dr. Hassan to start with his presentation, and maybe we can move there if you like, or can you see from here? Are you okay?
Yeah. What I really liked about it was the term societal failure. So kind of we are not pointing fingers at somebody for this failure. It's kind of a collective appraisal for this. And so whatever I say, please take that in that sense. And the focus is on provision of clean drinking water. But before going on that, I would try to have a little broader approach, because for the water, the two main issues are accessibility and drinkability. And let's see where we are globally in terms of availability of water or in terms of water risk. So for all of this, whatever I'm going to present, I would be relying on some national or international reports or some findings from academic journals. And I would begin with a recent IMF report of 2015, which says that Pakistan is in the list of the 36 most water-stressed countries of the world. And by water stress, they mean a ratio of your water use to water supply. In this report, IMF relies on some research done by World Resource Institute, which is a research organization based in US, usually works on topics of climate change, water across the globe. So I thought it would be nice if I take a deeper look at the data they are presenting on the World Resource Institute's website. And they had some nice, colorful heat maps. So this is one of that, which is showing the overall water risk in this region. So this risk is based on an aggregated indicator which takes into account quality, quantity, and other regulatory aspects. And we can see that most of the country, so if you can follow this boundary for Pakistan, most of the country is placed in a high risk area, and particularly this eastern belt across the Sindh and Punjab province, and something over here in Balochistan in adjoining Quetta. All of us have heard already about the falling or depleting water table in, let's say, major urban centers in Lahore, which is usually referred to as either 1.5 or 2 feet annually. For Quetta, I will tell you a little more about in a little while. And besides this, they have, so this is kind of a current situation map. Besides this, there are some future projections also given on the website. So based on a business as usual, like everything is going on as it is going currently, they find out or project percentage changes in water stress. So we see that almost leaving aside a small corridor in the center, most of the country is going to face an extremely high change in the level of stress, and this is for the year 2030. So in the year 2030, we are going to face something like this, and which is not just only for Pakistan. We can see that this high level of change in the water stress is almost on the eastern side of Pakistan, in India, on the western in Afghanistan. So this is kind of a situation which we are looking forward in case things go on, and we do not go for any major intervention to prevent this. So I was a little skeptical about these two figures, which were a little alarming also. So I thought it might be a good idea to take a look at change in water availability, per capita change in water availability over the years. And the IMF report, which I earlier mentioned, also talks about that. And we see that there is a huge or drastic change. So from the early years of independence till recently, per capita water availability has gone down. And the IMF report predicts that by the year 2025, we are going to face a serious water shortage in terms of our supply and demand if everything goes on as it is right now. So having said all of this, I have, or anybody can have a feeling that there are certain institutional or management issues going on. And from an economist's perspective, I would say that probably we have not been able to, through whatever mechanism we could think of, we have not been able to incentivize conservation of water over the years. Instead, we have probably incentivized an inefficient utilization or wastage of water. And this could possibly have happened because of the position that we have kind of not assigned the correct, through our pricing mechanism, we have not assigned the correct value for the commodity, or the true value for the commodity, and that is why we see this wastage of water. So the IMF report further goes on and points out that Abhiana, in case of the agriculture sector, just recovers 24% of the O&M cost, and even there, the collection rate is very low. For the urban sectors, usually, and this figure of 50% is for Wasa Lahore, that all the revenues collected, whether on water charges or sanitation charges, they meet up to 50% of the O&M cost. And if we, as I just said about that pricing thing, so just to point out, the last time we revised the tariffs for the urban water was in the year 2004. After that, there is no revision of the tariff to be charged, and even most of the households, almost like more than 90% in Lahore, are being charged on a flat rate basis, just on the basis of the size of the house. Metering is perhaps to the extent of 6 or 7%. So all of this points out some of the institutional issues management issues which have resulted in the level of stress in which we are currently. Because as other studies point out, being a water-stressed country is not bad if you are able to manage that. Because, for example, Singapore also faces a very high stress of water because of usage and availability of water resources, but they are able to manage that situation. So probably some better management could relieve this situation. Okay, now I would come back to the point of focus today, which is the quality of water. And for this, I would rely mostly on a recent report by Pakistan Council for Research and Water Resources, PCRWR. So PCRWR has been involved in assessing the quality of water since 2002, and they had an extensive project between 2002 and 2006 in which they did various surveys and collected samples to find out the quality of water across Pakistan. A recent exercise done was in 2015-16, in which they picked up 369 water sources and then checked water samples for the physico-chemical properties. And just to mention over here, so these samples, these sources of water were picked up across the country. And if you remember that red area adjoining Quetta earlier, so based on their earlier surveys, they had selected 38 points for water collection in Quetta. And when they went back again in 2015-16 for collecting samples, they found out that 7 out of those 38 water sources had already dried up. So they restricted their samples to 31. If we go for the national statistics, we find out, based on these chemical examinations, that we are able to provide safe water to kind of 31%. So because 31% of those samples turned out to be safe for drinking, whereas 69% had various sorts of contaminations. And what were those contaminations? So these are from microbial element or bacterial element, followed by arsenic, which is 24%, some nitrate, probably because of use of fertilizers, and fluoride at some places. Again, I would ask you to remember this arsenic figure of 24% because we are going to use it later on. Okay, please go ahead. Okay, so apart from that national figure, I thought it would be relevant if we focus on Punjab, and we see that there is not a very bigger change or significant change in terms of the samples being categorized as safe or unsafe. So Punjab is doing a little better, but the samples were categorized as safe for 35%, 65% were unsafe for drinking. And the major issues in case of Punjab, again, were microbial contamination. So in urban centers, possible causes for this, which like various studies have also pointed out, is improper disposal of municipal solid waste. The infrastructure or the water network is old. There are leakages in that, so water gets contaminated. And at certain places, certain cities, there is close proximity between the drinking water and the sewage water pipelines, and often there are issues of intermixing of these two things. So in the rural areas, open defecation or animal waste going to streams is the cause of this microbial contamination. Chemical pollutants, they enter into this water thing whenever we have untreated disposal of industrial waste, or they could be linked with fertilizers use. So usually nitrates come from fertilizers, and nitrates cause or impair the blood carrying capacity of hemoglobin, caused baby blue type disease or death, something like that. Okay, so go ahead, please. And okay, Coming to other issues, so arsenic, which is found in 24% samples across Pakistan. This is a little more serious over here in Lahore. 100% of the sources tested were found to be contaminated with arsenic. And this happened once WHO revised its guidelines from 50 parts per billion to 10 parts per billion. Arsenic is a little tricky because it does not add odor or color to or change the taste of the water. So it's hard to, or it's kind of a challenge to sensitize people on the presence of arsenic in drinking water. The possible causes could be geological, could be human activity, but it has some serious implications in the form of skin cancer or miscarriages or underweight birth of a child. And so we'll talk about this arsenic thing a little more detail in a while. And what we have found out, we have done a small study on that also, so I'll share that with you also. Hardness in water is found out, according to PCRWR in Bahawalpur and Faisalabad, could possibly cause kidney and bladder stones. So these are the main issues reported in the PCRWR report. Please go ahead. Okay, so now I would share something more specific about the arsenic issue. And recently there was a paper published in a journal, kind of a highly reputed journal, Science Advances, which is an offspring of the famous Science journal, in which Dr. Joel Podgorski, who is an environmental scientist working in Swiss Federal Institute of Aquatic Sciences, he and his team collected samples from 1,200 wells across Pakistan. So, and their focus was to figure out the chemical composition of water, particularly arsenic. They had done earlier, in somewhere in 2000, similar kind of studies in Bangladesh and India. And from the results of those samples, they found out that in 2/3 of these wells or samples, the level of arsenic exceeded the WHO recommended threshold. So this was kind of alarming. I'll show their maps and data also in a second. What they did was that they used this data set and used an empirical logistic regression model, developed a grid of a square kilometer, and then using population density, tried to find out how many people are in a risk of consuming arsenic contaminated water. And according to that likelihood estimate or probability estimate, they found out that 50 to 60 million people are in the risk of consuming arsenic contaminated water. So I guess from the recent census, we are a nation of around 200 million people. And that 24% arsenic found out in the samples corresponds with this figure. So a 24% of 200 would be something close to this figure. So this is some kind of an external validation for whatever were the findings of Joel Podgorski and his team. And we tried to develop some collaboration with them, so they shared their data with us. And a group of students worked with me. So we used some health survey data set in 2 time periods and try to find out, is there any link between the presence of arsenic and the diseases likely caused by arsenic over a period of time? Because the impact of arsenic is, the earliest it can be seen is after 10 years of use. So we used data set for the health indicators from 1990 and 2012 and found out that in southern Punjab, some parts of Sindh and other industrial zones such as Karachi, Lahore, and Faisalabad, these instances or these types of diseases are more frequent. We cannot directly ascribe that to arsenic use, but this is the first kind of, the first base level type of finding, so we need to work more on that. Okay, please go ahead. Okay, 15 minutes already. Okay, So give me 5 more minutes and then okay, thanks. So quickly, this is the Joel Podgorski's sample map. You can see the yellow, red, and pink spots are all the places where arsenic is in excess of the WHO recommended level, and mostly along the river Indus and its tributaries, this arsenic is high. And using the same data set as I earlier pointed out, they placed people on risk on a per square kilometer basis. So we can see that there are certain places where people are highly prone to consuming arsenic contaminated water. Lahore can be seen, some other parts in Punjab, Hyderabad, close to Karachi. So these are the places where people are likely to consume arsenic contaminated water. Whenever we are using contaminated water, and as a result of that, society has to be a certain cost. So I would say that these are the figures I got from, even if you do not believe those figures, these are the figures from PCRWR report. These could be varying. You can find out various figures, but there is definitely a cost which society faces in terms of health costs, in terms of the missed work days when you are sick because of consuming poor quality water. And there are mortalities, particularly child mortalities, linked with diarrhea caused by poor quality water. We have in a society, so we know that access to safe drinking water is a fundamental human right. Pakistan committed earlier under the Millennium Development Goals to reduce the population to 1/2 who have access to safe water. Now we have a much more ambitious target of providing safe water to everyone by 2030. After 18th Amendment, it's the responsibility of the provincial government to provide safe drinking water to everyone. And we have heard about Punjab Municipal Water Act. We have heard about Punjab Safe Drinking Water Policy. We do not know their exact status. Are they still drafts, or have they moved ahead of that? So we need to think some points over here. We have also similarly heard about the national water policy, and this draft started somewhere in 2005. Then later on, there was some disagreement whether there is a need for national water policy or is it just a provincial subject. And recently, I think what somebody told me is that the draft is lying with Council of Common Interests. So let's see what happens to that. And we need to think about very important questions like who owns the groundwater, because everyone can bore a well in his house and extract as much water as he can. Is there authority to control that? Who manages water quality standards, or even if there are standards, who is out there? I guess probably it's not the work of Supreme Court to manage or control that water quality. Some other authority should also be doing that. Who is looking after or controlling the industry waste disposal? So all of these are management related issues. Some more points over here. How can an effective public awareness campaign can be started? Which segments of the population need to be targeted? Can we actually estimate or have a good estimate of demand for clean water? And does social priming or financial priming, so giving consumers information about their social responsibilities or giving them information about what is the averting cost they are facing when the network water or the Vasa water they are getting is not clean, will that raise their willingness to pay for clean water or not? And probably this could remove some of the concerns any political government can have about changing the tariff of water. Some other questions, but let me leave them for some other time. Maybe some kind of a technology support, some kind of an app which informs people about the quality of water, the possible issues they can have, health or financial or others, could help people.
You have to wind up.
Just one, I think 2 more slides. And
नहीं, तो आधा घंटा हो गया
I'm sorry. चलिए quickly दो slides दिखा दें और बस देख लें. This is somewhere over here you need to, whenever we design an intervention, somewhere over here the maximum number of people focus in terms of their drinking water source. And this is, let's leave this, so go ahead. Yeah, this is just so probably for the solution we need to, so we usually use the term think out of the box, probably we need to think out of the bottle. So this is some entrepreneur who developed this wheel which can help women easily carry water along the plain areas, and this will save them 35 hours per week in water transport time. Thank you very much. Sorry.
It was a very enlightening presentation, and I'm sorry we had to rush you there. Now I'm going to request Dr. Tahir Majid to make his presentation. Dr. Tahir Majid is currently Chief Technical Officer at the Punjab Saaf Pani Company, and Dr. Tahir has worked on over 930 water waste treatment plants of various sizes, so all types of water wastewater technology, published a large number of research papers in various peer-reviewed journals, and has a doctorate degree from University of Technology, Sydney. Dr. Majid.
Punjab government initiative to ensure access to safe drinking water. Initially, our CEO was expected to come here, but he had to go for some urgent issue out of station. So that's why I'm here to present. So this is the contents of my presentation: background, water and potable uses. Then Pakistan and Punjab drinking water quality issues, missions, vision and strategic plans for current working and the future plans, and the Punjab government initiatives to overcome the water quality issues and related health issues, and the current approaches and the projects and the community participation in the whole process. So it's the background, water and potable uses. So we all know that our land is covered, two-thirds of our land is covered with water. So of that, 97.5% is salt water. Out of that, we just have 2.5% of around 3% drinking water, of which 70% of that water is blocked in ice and snow. So,
I'm sorry, we are running so far behind.
Okay.
Could you just move on to the Punjab?
Yeah.
Company?
So I will brief it this thing shortly. So the whole water, we are actually talking of the water, but I want to point out that we should the issue or the quality issues are not for the water. These are for linked with the drinking water. So usage in the household, we just use 9% in the household of the whole water that's used by our communities. And of that, we just use 10% in the drinking and cooking. And when we discuss about the standards, the drinking water, the quality standards, we are discussing just 10% of the whole water we are using. Yeah. So this is a Pakistan map, and now, since we are working, initially there were different plans for the whole Pakistan and quality drinking water standards, but now these are some of these things are focused just for the Punjab area. And this map shows that indicates general groundwater quality in Punjab, and we make 2 or 3 different criteria to evaluate the water quality. Here we are making total dissolved solids as a main factor to indicate whether water is good for health or not. So it shows different areas where the water is brackish or mixed or is available sweet. So these are also some maps which indicates the intensity of the pollution in different regions. Just move forward. So if you see that we can see that percentage of safe unsafe villages in Punjab, 73% of the villages in Punjab are getting having access to, don't have access to the safe drinking water, sorry. And if we talk of the chemical and the microbiological contamination, we can see that 77% of our villages are not getting good quality drinking water. So these are some of the pictures how the people catch the water for their usage. So looking at all those issues, the government of Punjab has developed some strategies for providing good quality, safe drinking water. So the vision is that safe drinking water is accessible at premises, available when needed, free from contamination on sustainable basis to the entire population of Pakistan. So this is a main primary vision for the by the government, provided by the government of Punjab. Yeah. So we have developed policy strategic plans to ensure that everybody has access to safe drinking water. So we have made SDGs, and now we are planning that up to 2025, the whole population of the Punjab will have access to the clean drinking water. So now we look into the Punjab data. So we have about 94.6 million population, and covering 9 divisions, 25875 villages, and more than 6,000 union councils. So we're working in a very large segment of area. So if you look into the population, so total population 94.6 million, and the rural population is 69.62 million, and unserved rural population 58.32 million. So we have actually, the government of Punjab is working in has developed 2 main programs. One for that's looking for the rural population to provide safe drinking water. That's managed by local government and TMAs. And for unserved rural population, that's under the scope of Punjab Saaf Pani Company. So these are the 5 main plans, programs that are being used by the government of Punjab to ensure that all segments of our Punjab province will get safe drinking water. So WASA is working in 5 major cities, Public Health Engineering Department. They are also ensuring water supply and sewage. Basic Health Program, it's a new program that's used to upgrade or restore functional water supply scheme. TMA local user committees, and the Punjab Saaf Pani project that's also in rural and peri-urban area. So this is the overall scope model of the proposed model for the Punjab Saaf Pani Company. We have a Saaf Pani Tanzeem organization, then work through the contractor to install and commission the water treatment system, and then ensure its operation through the union councils and the community itself. So again, it gives the objectives of the Punjab Saaf Pani Company, again saying that improves access to the safe drinking water in unserved and underserved rural communities of Punjab, and educate them to adapt improved hygiene practices. Actually, to implement this plan, Punjab Saaf Pani Company has now been divided into 2 parts. One, Punjab Saaf Pani Company South, and the other Punjab Saaf Pani Company North. So this indicates the area scope, the work scope area for the Punjab Saaf Pani Company South and Punjab Saaf Pani Company North. So accordingly, everyone would be interested to know how we are going to start our work. So we look into the priority districts. Priority districts means where the people are not having a good income, so that they can buy bottled water. And the second criteria is that where the water quality is not too good. So these are the priority districts where initial working has been started. So how we execute our plans? We go through rapid field assessment, social appraisal, saaf pani tanzeem, through saaf pani tanzeem and selected villages. Then the people acquire land, select land and land for the plants and the solar centers. And EMCs on the other side start their design and design process, and then RFBs and the work award is made on the basis of the RFB. Contractor mobilization, contractor mobilization and the site work is started, then the plant installation and commissioning. And now looking to the past problems that initially in some of the areas the plants were installed but they were not kept properly maintained. So in this, in the current scenario, we are giving responsibility to all the contractors that they will not only just install the plant, they will also look after the operation and maintenance of those plants and ensure the quality drinking water for 5 years. And then after 5 years, these plants will be handed over through the community engagement. This will be handed over to the local people or local bodies. So again, just highlighting the same things which we have discussed earlier. So this is a project layout plans for the Saaf Pani Company South, and I showed that in 2017, 18, and 2018, 19, we are serving about 120 million people. So these are some of the plants which Saaf Pani Company has installed in different areas. These are just pictures of some of the few plants. Some of the plants are powered by solar because there is no WAPDA grid or grid power supply available. So some of the parts are operated to solar energy. So again, giving the main task of for any of the system we install, we design of the community and the youth engagement, and the community mobilization, and then youth entrepreneurship. We are trying to encourage youth to look into the scope of this water business, and so that they may go and try to have the property rights after the 5 years of operation and maintenance of the project. So again, these are silent features, achievements we have made so far in the field, mainly about land acquisition and the community mobilization and other activities which are required to run our process at a fast speed. So this just indicates that we are also trying to engage community and to so that the people feel that all the things which the Saaf Pani Company or the government of Punjab is doing is for their benefit, and they should own all the investment we are making on behalf of the government of Punjab. So you can show just the community participation at different levels in this program. I just have last slide. So we are using different marketing and media campaigns and try to make sure that the message we want to, the benefit we are delivering, the efforts we are making in this program, the people conceive those things and understand that this is the right time they can get benefit of all the activities we are making for them, we are doing for them. So it's our responsibility that providing Saaf Pani is our responsibility.
Mr. Hamad Naki Khan. He is the currently Chief Executive Officer at the Worldwide Fund for Nature, Pakistan. He was a former Executive Engineer at Irrigation Power Department, Power and Irrigation Department, and he has a Master in Science in Engineering, Water and Environmental Management from University of Birmingham.
I think looking at the topic, we need to understand that which of the key actor or stakeholder in the society failed to provide, the safe drinking water. Society, instead of blaming the whole society for this failure. We need to keep that in mind, that provision of potable water is a basic human right. This is the right which has been provided by the Constitution of Pakistan. So as such, primarily it's the responsibility of the government, ranging from the, the federal, the provincial, local government. It's a subject of local government, but a lot of policies, they are done at the federal level. A lot of policies, they are done, enacted at the provincial level. Few facts which were mentioned by the two worthy speakers, I think we need to keep that in mind. Honestly, it's a very serious issue. Dr. Hassan talked about and showed the scientific advances, the journal where this report on arsenic, was reported. They talk about 60 million people who are exposed to arsenic. Arsenic is carcinogenic. Arsenic is odorless and tasteless. You can't detect. But if you look at the southern part and the eastern part of this country, you'll find that a lot of the water sources are contaminated. He showed the figure of the WHO, which is 10 ppb. Pakistan water standards, they have kind of a slightly relaxed figure. The Pakistani standard says it's 50 ppb, but still, despite the fact that our standards are relaxed, are not that stringent, but you'll find a lot of sources of drinking water where the quality of the water, particularly the arsenic, exceeds that particular limit. So a vast majority of the population is exposed to that. Now, what is the impact? Arsenic is just one, but Dr. Tahir Majid also shared the data. Recently, a report of this Punjab Primary and Tertiary Healthcare Services, look at the people who are exposed to waterborne diseases and look at the hospital admissions just because of water-related diseases. So you ignore one sector, you automatically increase the load of another sector. Look at the growth of different industrial sectors. Pharma is one of the promising sector in the country. Who connect the dots? Nobody connects the dot. That why the pharma industry is blooming like anything. Where are the epidemiological studies which state that, okay, this is the main reasons of, high number of waterborne diseases. This is the main reason of, high number of child or infant mortality rate, and so on and so forth. Very few epidemiological studies. The studies shown by, again, Dr. Hassan, PCR-WR, 70% unfit for drinking, And in one of the presentations, which I remember I made to the Prime Minister, I said, sir, if you open the tap of the Prime Minister house, I can bet you won't get potable water in your tap. So that's the situation. Even the Prime Minister can't get potable water in his or her tap. So let's keep that in mind. And then comes the priorities. Then comes the development priorities. If it's a basic human right, if the situation is that serious, is that sector getting the priority which it deserves? Unfortunately, no. The development priorities are diverse. Infrastructure, I mean, these are all important, but not at the cost of public health. And then when civil society raises this, then we are also criticized and we are also blamed that we are kind of anti-development. But, I think setting the right priorities is critical. The result is that when you do not set your priorities right, you do not allocate money, you do not allocate funds. And then you see, you see the result. When you do not allocate funds, the result is that despite decades of VASAs working in this country and other departments, not a single drop of water is being treated, wastewater, all untreated sewage. Now what you are doing is that you are polluting, contaminating the sources of drinking water, and that's where, we highlight this problem. Because to us, it's critical. Prevention is better than cure. Yes, you establish Saaf Pani companies. You, during the General Musharraf's era, you started clean drinking water for all. You spent billions of rupees that we'll put up a water filtration plant in every UC. We have this magic machine, everybody will get potable water. What's the result? Who's getting the potable water? No one. Because you are not protecting your sources, but you have these magic machines which you can put everywhere. I'm not against these magic machines. I'm not against filter. We are also doing this because in many areas, literally many areas, situation is so critical. If you do not do that, people won't get immediate relief. You go to Cha Kallanwala, it's like 30 kilometers from Thokar Niaz Beg. High levels of fluoride. 80% of the people fluoresces with their deformed bones, and if you look at their teeth and you look at their, the adults even can't stand because they're getting high levels of fluoride in their drinking water. But they have a very good road in that particular village. So I think it's important because I'll be talking about solutions. So setting your development priorities right, protecting the sources. And for protecting the sources, you have, again, Dr. Saab mentioned about national water policy. It talks about water council. It's with, you're right, sir, it's with the Council of Common Interest. We are really pushing because I remember reviewing the first draft in, I think, 2002 or 4. It's 2018. Draft, idhar draft, udhar itaraz, idhar itaraz. For God's sake, but the thing is, I'm also not, in favor of having a lot of policies where the implementation and compliance is weak. What's the point of having policies? We have policies for literally millions of things. But if we do not want to, comply or follow those policies, but still, the final draft which I saw, there was no representation from civil society. And I'm so happy that the present Secretary Water Shmail Khwaja, highlighted that, and now there is, if you look at the proposed Water Council, there is representation of civil society or relevant academic and research. Dr. Hassan also talked about water pricing. I think it's important. It's a basic human right, but we can't, I live in model town. I see, so much wastage of water because 5 मरले के घर का ये रेट है, 10 का ये है, कनाल का ये है, वो नल का बंद ही नहीं करना. So it's a drinking water. Can we afford to use drinking water for horticulture purposes? What about PHA? Why are they using the drinking water, the groundwater, which is, we did this study 2 years ago. Between 2 to 3 feet, Lahore's groundwater, the depth of water table is going down. We were really fortunate to have good aquifers, sweet water available. But what about our next generation? I don't think that my grandchildren will have that luxury to, now they're talking about, building a small dam near Siphon to kind of make an artificial man-made lake for providing, water to Lahore. And Lahore is fortunate. You go to South Punjab, you go to Upper Sindh, I was in Balochistan last month. Honestly, Quetta is literally, has already dried. They use fossil water. So that's the situation. We are not water stressed. In many areas, people have no physical access to water. That's the situation. And that's where organizations like WWF keep on propagating, advocating, lobbying, to set your priorities right. Because I think, as human, forget wildlife. We can't say that, but even for the sake of argument, We are not talking about having a water hole for chinkaras and ibex and leopards. We're talking about people. We're talking about the nexus between nature and people. And we are talking about the urgent need to protect your water sources. Groundwater, if once contaminated, is impossible to treat. Surface water ko aap kar lenge, treatments kar lenge, activated sludge, ye, wo, trickling filter. What about the aquifers? Your aquifers are drying up and you are contaminating your aquifers because you're literally, not treating your wastewater. I would, just lastly, and then I would, because I think Punjab Saaf Pani, I mean, sir, please forgive me, I mean, I don't want to criticize you, but the thing is, since you are here, I think it was established 3 years ago. Just having, and then I don't know how many CEOs were transferred, fired, terminated, and all kinds of, so our problem, I was on the board of Lahore Solid, I resigned, because when you start setting up parallel governance mechanism in the presence of existing departments, yes, the rural areas, the TMAs and the local government is responsible. Urban areas, VASAs is responsible. You also have public health engineering department. You have public health engineers. You have people who can design water treatment plants, piped water supply schemes. So either fire them. It's my money, it's taxpayers' money that you're spending on public health engineering, and you're spending, on, and then you do all these road shows in Dubai. The delegation goes to Paris to study, the drinking water system in Paris, and then doing road shows. I think also the delegation went to China, to Dubai, just to attract investors. How many investors came? No one. How many, what's the result? How many people in the Pari, or in the rural areas where you showed the pond? I remember in one of the projects in South Punjab, I literally saw it on, from my own eyes, the cattle and the human using the same pond, for drinking water purposes. So as a Pakistani, we are concerned that we are not setting our priorities right, and we are not protecting our water sources. And it's not about, the sensational statements that the next war will be on water, and people, the war has already started, honestly, in many areas. So just a few thoughts which I thought would like to share. Thank you very much.
Thank you very much, Dr. Ahmad. Now, before opening up for question and answers, I think it's been a very interesting presentation, and I would support what Ahmad said, that so far government's initiatives have just been going around in circles. We haven't seen anything on the ground. I was hoping that we would see some data and some numbers today of so many people being provided clean drinking water, but we haven't reached that stage. I'm sure you have questions on that. Dr. Hassan provided us with some background on what the situation is like, and it's obviously really, really grave. And as Ahmad had pointed out also, that there are sort of very clear-cut approaches. I mean, since it is a serious situation, we need to set our priorities right. Then we need to stop contaminating our resources, and finally, then we have to price the water right, so that at least people will use it carefully, rather than on a flat rate. We know if the tap is not closing, nobody is going to bother to fix it or shut it. So those are some of the issues. And now I turn to you, and we have about, we started a bit late, so we'll give about 10-15 minutes for question and answers. So what we might do is to collect a few questions at a time, and then let the persons you've asked respond to that, and then we can repeat that process so that we don't forget the question by the time you end up, or it doesn't start into a one dialogue between two people. So thank you. So please carry your questions, please. So, and also identify yourself, please.
My name is Mr. My name is Syed Nihal Asghar. I am a chemical engineer by profession, working in the area of water and wastewaters, I think about 35 years of experience. मैं गुजारिश यहाँ पे ये करना चाहूँगा कि साफ़ पानी का जो प्रोजेक्ट गवर्नमेंट ऑफ पंजाब का मेरा ताल्लुक़ रहा है जब क्लीन ड्रिंकिंग वाटर इनिशिएटिव लिया था मिनिस्ट्री ऑफ एनवायरनमेंट ने, उस वक्त से लेकर आज तक मेरे ख्याल ये टोटल फेल प्रोजेक्ट है। किसी किस्म की ना हम लोकल टेक्नोलॉजी डेवलप कर सके। आज तक कंफ्यूज हैं कि हम सिंपल फिल्ट्रेशन सिस्टम पे जाएं या हम आरओ पे जाएं। जो फिगर्स दिए गए हैं 69% माइक्रोबायोलॉजिकल कंटेमिनेशन, 100% आर्सेनिक की कंटेमिनेशन, तो इसमें तो हमें सिर्फ शायद मेरे ख्याल में आरओ टेक्नोलॉजी पे जाना पड़ेगा। दूसरी बात ये हुई कि हम जो पानी इस्तेमाल कर रहे हैं हम अपनी गार्डनिंग में PHA, I submitted a very good proposal to the PHA and PHA was accepted that to treat a water, waste water, ये इकोनॉमिक्स कॉलेज, गर्ल्स इकोनॉमिक कॉलेज के पास हमने इसको प्रपोज किया था। सिंपल ट्रीटमेंट, नॉट एनी कॉम्प्लिकेटेड, सिंपल रोटरी बायोलॉजिकल कॉन्टैक्टेड टेक्नोलॉजी। उस ट्रीटेड वाटर को बजाय हम एक्सट्रैक्ट करें, बात हुई थी ये भी, बजाय हम एक्सट्रैक्ट करें वाटर और उसको यूज़ करें फॉर इरिगेशन के लिए, आप सिंपल ट्रीटमेंट के साथ उसको रीयूज़ कर सकते हैं। एंड अनदर थिंग विच आई थिंक हम बहुत बुरी तरह से पानी को मिसयूज़ कर रहे हैं, दैट इज़ कार वॉशिंग, सर्विस स्टेशंस। आई थिंक हम रीयूज़ की तरफ बात करें, रिसाइकिल की बात करें। इस पे भी मैंने प्रपोजल एक सबमिट किया था कि हम इसके ऊपर काम करें। मेरे ख्याल में मेरी 2-3 यही सबमिशंस हैं।
My name is Mahmood Ahmed. I'm working for WITS LUMS. My question is with Dr. Majid. One figure I'm a little bit surprised that agriculture is using 65%. I think you have made my job very easy because the figures I get really around from different databases, it's about 96% of water is being used by agriculture. If my work in Morocco, we figured out if we can just save 5% of that water, that is good enough to serve for all other competing uses. So I think I would like to, for me that was a very surprising. The other very quick one, another very quick one, the water pricing. I think willingness to pay, we don't have to go very far. Just look at what water markets in Karachi or other rural areas people are willing to pay for the water. That tells us the whole story. Thanks.
Thank you.
My name is Alize and I'm working for the Special Monitoring Unit at the Chief Minister's Office. My question is with regards to, it's a twofold question with regards to a statement that was made by Dr. Hassan. You mentioned that 100% of the water sources in Punjab were contaminated. Lahore, yeah. So 100% of the water sources in Lahore were contaminated. So first of all, I would like to ask about the methodology. So how was that identified? And second, in order for the government to make any measures to sort of at least identify water sources that are producing the worst health outcomes, do we know what degree of contamination is leading to bad health outcomes? Because you mentioned that you were using WHO standards. So are those the standards that will lead to sort of the health outcomes that you identified in that same slide? Or are the standards for that degree of contamination much higher?
Thank you.
Thank you.
We'll take a couple of more questions. Yes. Can Anjum and then, sorry, after we go, yeah.
So there are these health outcomes which are, but there's also water scarcity, and we'll run out of water at some point. And I read or heard recently that Cape Town in South Africa is going to run out of water in April this year. And so they haven't addressed that crisis, and it's just around the corner. So I'm wondering how much time do we have to address this issue of when really after which it's a point of no return. So do we have another 50 years or 100 years? So what are we looking at?
Assalamu alaikum. Fazilda Nabil from the University of Sussex. I have 3 quick comments / questions. I really appreciate the point that Hamad Sahab made about parallel governance structures, because in my experience also I've seen कि public health and engineering department or TMAs or जो local environment department है उसके अंदर कोई भी coordination नहीं, nobody is willing to own and maintain especially drinking water, groundwater and drinking water systems. The second point is that I wanted to ask Dr. Hassan and I mean the three speakers generally as to the experience with community ownership and management of water filtration plants once they are made and they're handed over to the community. What has been this general sort of experience in the community maintaining them? In my experience, in my field work, I've worked with some communities where the community, it was a small community of about 800 people. उन्होंने अपना filtration plant खुद ही लगा लिया. They got together, they poured money, and they put up a bore. My third question is about arsenic contamination. And about the need to bifurcate the sources of arsenic contamination. Some of it occurs naturally in soils, but is there a study, or are we looking towards a study that looks at the source as industrial pollution as a source of arsenic contamination? And more importantly, something that goes unnoticed, a lot of agricultural fertilizers are sources of arsenic, and that seep into the groundwater and contaminate the groundwater tables. So that bit about the sources of arsenic contamination and the community ownership would be the 2 questions.
Thank you very much.
Thank you. I'm Mohammad Irfan from the urban unit. सर यहाँ पे जो अभी तक डिस्कशन हुई है उसमें ये मुझे पता लगा है कि one part is the scarcity of the water. And the second one is the contamination in the water. So Water Act तो अप्रूव नहीं हुआ हुआ, वो तो मसला scarcity का तो इशू मेंटेन रहेगा. जो दूसरी चीज़ है वो है contamination and especially the arsenic. और ये हमारा यहाँ पे उसका प्राइम यहाँ पे डिस्कशन है. आर्सेनिक के ऊपर अर्बन जो रूरल एरियाज़ हैं वहाँ तो शायद साफ़ पानी कंपनी उसमें रोल प्ले करेगी. ये जो लाहौर में और हमारे अर्बन एरियाज़ में कंटामिनेशन जो बहुत ज़्यादा इंक्रीज़ हो गई है, so do we have some action plan on the arsenic contamination reduction? Thank you very much.
You should tell us. You're from urban unit. You are the planning body of, आप हमें बताएं यार.
My name is Kamran. जैसा कि हम जानते हैं कि डॉक्टर हसन साहब ने I am from Kamran. I am a working businessman as a डॉक्टर हसन साहब ने आर्सेनिक के बारे में बहुत ज़्यादा बताया. एट द मोमेंट राइट नाउ फ्रॉम वेयर वी कैन गेट a right one water, because the Saaf Pani's company is taking a too long time to provide us a clean water. Yeah, so that's why what is the basic source how we can get a water, clean water at the moment right now, because the only source we are getting a clean water from the Nestle, Karshi and the Gourmet or Dose. Yeah.
24 कंपनीज को कल उन्होंने बैन किया.
So
Supreme Court.
Yeah. So what we have
24.
Yeah, 20. What we have a second option. Any source?
Assalamu alaikum. Myself Abdur Rahman, and I am the student of Public Administration from the University of the Punjab, Institute of Administrative Sciences. So my question is कि as Mr. Hamad said कि जो पाकिस्तान में जो मिसली इशू आ रहा है पानी का, वो पानी के रिसोर्सेज जो हैं उस पर हम उसको भी हम कंटेमिनेटेड कर रहे हैं. सो आई थिंक कि जो अगर हमने पानी को साफ बनाना है तो इट्स अ बेस्ट थिंग इज़ कि अगर आप वाटर डैम्स बनाते हैं, वाटर डैम्स, सो दैट द वाटर में कलेक्टेड एट वन प्लेस, और बाद में उसको पानी को बाद में सही तरीके से डिस्ट्रीब्यूट भी किया जाए. सो व्हाट द गवर्नमेंट इज़ डूइंग इन दिस परस्पेक्टिव कि वो डैम्स में क्यों नहीं कर रहे, इसी तो इलेक्ट्रिसिटी का भी वो जो है वो प्रॉब्लम ख़त्म हो सकती है और पानी का भी जो रिसोर्सेज हैं उसको हम बेहतर तरीके से इसको बना सकते हैं. और फिर जो रिसोर्सेज हैं पाकिस्तान ये पानी के रिसोर्सेज हैं जो सोर्सेज हैं उसको हम उसको कंटेमिनेटेड होने से बचाने के लिए व्हाट वी आर डूइंग. सो माय क्वेश्चन इज दिस.
Thank you. I think, I'm sorry,
Yeah.
we're going to have to. चलिए आप पूछेंगे कि.
Okay, sir, I'm a student of GCG University Lahore. I had two simple questions. You said something about everyone said something about Lahore's water resources being scarce, and I'm trying to build a dam in order to recover those resources as well as water being used by different sectors. I had a question: why don't the sectors which are using the waters take part in the waste management and recycling of these water resources? The Parks and Horticulture Agency, for starters, they use a large amount of water, and according to a couple of studies conducted by our universities, some of the major parks in Lahore run right parallel to a large number of sewage networks, drains, and projects like waste sludge treatment or parks. Sorry. Treatment plants, etc., can be incorporated in these parks themselves. As well as these agencies have resources that they can conduct themselves, and they use a large amount of water. We use fresh water for gardening our plants, etc. We should really looking for more sustainable ways. And second, I had a question. As you can see, a large number of private contractors are importing RO plants and making their own business, starting their own business with water treatment. Do you think that can be sustainable practice for other cities and other nations? And what do you think is the future of water treatment?
Thank you very much.
Assalamu alaikum. My name is Aliya Hasnain and I work at the SMU in CM office. Sir, I have a question for the official here representing the Saaf Pani company. Sir, I'm aware कि आपके 116 plants तो already functioning हैं, filtration plants जो आपने last year में install किए हैं. तो जो आपके आगे के जो आपका timeline है, what does it look like for the rest of these plants to be installed? तो अगर आप उस पर थोड़ा सा बता सकें. Thank you.
Assalamu alaikum. My name is Imrana Tiwana. I'm an architect and environmentalist, and I'm from the Lahore Bachao Tehreek and the Lahore Conservation Society. I have a brief comment and a question. And my comment is that I believe that in 2018, Lahore being one of the most polluted cities in the world, probably the most polluted, water levels are 100% contaminated. We are in a state of absolute and critical national emergency. I also believe that our policies and priorities are completely misguided. It is the Human Development Index that needs to be developed, and we've been talking about it for years and years and years. There is ad hocism in everything we do. There are laws, but there's no compliance, as Hamad said. So we all realize the importance of this, and I'm very happy that there is a forum on this. And my question would be, of course, I had a smaller question about why the filtration plants don't work, and that's really a micro question here. The larger question to the three speakers would be that if you were given the authority to do absolutely anything and have all the resources in the world at your disposal, what would be the first 3 steps to eradicate this in 8 weeks?
You can go first, or you would not like to do that. Okay, so we'll do that, and then Manisa, and then Hassan can end up with. So you can address the questions that were referred to you.
I think I didn't Okay. I think I won't address all the questions, but just few of them. As far as my information, the 70% in agriculture, sir, is a global figure. Globally, 70% of the available fresh water is used in agriculture, but in Pakistan is 90% plus. The available fresh water I think it's more than 90%. But 70% जो मैंने दिखाया वो global figures हैं. Yeah, वो पाकिस्तान की नहीं है. The community participation in plants, you know, what works and, you know, the things which don't work. So we were also approached by 2 of our corporate partners to help them in providing potable water, and the solution was so critical, high levels of arsenic and few other contaminants. So what we did was that we first mobilized the community, because I think for sustainability this is critical. Until and unless there is ownership, वो वही होगा कि कोई आके लगाएगा जो कहेगा कि मेरी तो बाप दादा भी ट्रीटमेंट प्लांट का काम करते थे, उसने लगा दिया, उसके बाद मेंटेनेंस नहीं होगी, वो पानी और गंदा हो जाएगा. सो वी साइन अ लीगल कॉन्ट्रैक्ट जिसमें एक जिसमें उनकी ओनरशिप होती है, उसमें फ्रीक्वेंसी जो मीडियम्स होंगे वो कब उनकी रिप्लेसमेंट होगी, वाटर क्वालिटी PCRW के साथ एक एग्रीमेंट क्वार्टरली उसकी वाटर क्वालिटी मॉनिटर करेंगे, वेंडर के साथ एग्रीमेंट, और फिर कम्युनिटी ओन करती है. तो वहाँ पर अभी एक को 1.5 साल हो गया, एक को 2 साल हो गया, तो वो हम जो रिपोर्ट्स आ रही हैं वो चल रहा है. अनटिल अनलेस कम्युनिटी ओन करेगी तो ये चीज़ सस्टेनेबल नहीं होगी. और ओनरशिप का मतलब है कि उनकी कंट्रीब्यूशन भी होनी चाहिए. इफ़ दे डू नॉट कंट्रीब्यूट दे वोंट ओन. जब तक उनकी कंट्रीब्यूशन, इफ़ यू नो देयर इज़ नो फ्री लंच, अगर बिल्कुल सब चीज़ें यस ड्रिंकिंग वाटर, लेकिन वो वैसे भी तो इफ़ दे बाय बॉटल्स 19 लीटर वाली, गैलन्स वाली, तो दे पे. सो वो अगर वही जो सवाल था कि जी क्या करें अगर नहीं मिल रहा, आर्सेनिक है, तो देयर आर फ्यू maybe trusted sources, so-called trusted, जहाँ से आपको लेना पड़ेगा. Priorities की और जो 3 और वो I think देखें, अभी हमने recently एक campaign किया. We need support from think tanks and people like you. We said कि जी अगर एक कहा जाता है कि इस सेक्टर में compliance करनी है, environmental legislation, no. First ask the municipalities to do that. किसी और को कहा जाता है वो it's just like a blame, never-ending blame game. So what we said, every country has a water classification standards. All their water bodies are classified according to their usage. If Rawal Dam is used for drinking, it has to be class A. If there's a stretch of river which is used for recreation or fish farming or agriculture, it should be class B, class C, class D. आप पूरे, और हमने कहा कि we'll help, with government should support that. We'll using the remote sensing and GIS, we'll map and you should notify those classifications. Now that becomes your priority. Priority है कि जो class A की जितनी भी water bodies हैं, you will ensure that the water quality remains class A, because that's where the water is used for drinking. So फिर इंडस्ट्री शोर नहीं मचाएगी कि नहीं जी नहीं, पहले आप उसको करें, म्यूनसिपैलिटी शोर नहीं मचाएगी. So across the board, पूरे पाकिस्तान में आप ये इसको implement कर सकते हैं. That's where we have started our lobbying exercise as part of Pakistan Waters at Risk. So I think एक तो ये बहुत ज़रूरी है. बांग्लादेश की में water classification है, श्रीलंका में है, इंडिया में है, चाइना. You go, developing countries, small countries, big countries, all have water. We don't have water classification. So I think that's like critical. I think so 8 weeks, at least start implementing, classify करें, और उसके बाद 8 weeks में तो miracle ही होगा. Honestly, but in certain areas we need miracles, those miracles could be in the shape of like Kallam wala, इस किस्म के जो areas हैं, वहाँ पे तो you have to come up with some ad hoc measure treatment, whether it's a RO या कोई भी है, because people are exposed, people are getting all kinds of deformities and diseases.
Couple of minutes more at maximum.
I'm done.
Okay.
Yeah.
Excellent. Okay. Thank you, Majid sir.
Okay. So I have received a number of questions directly pointed out to the Saaf Pani company and our objectives, performance like that. So first of all, I would like to say sorry that we did not come up to the expectation of the public. There are a number of reasons for that, and I don't want to go into these details right now. But as I mentioned that we're struggling hard to ensure that the whole community, unserved public, and not only those people, but also in the rural and urban areas, everyone will have access to the clean drinking water by 2025. Is the goal we have set for ourselves. There are a number of issues regarding the water quality and the perceptions we have. Just as first we need to see what's the issue with the water and how it affects our health. Whatever figures we are discussing here, I think we don't have direct links with the water quality and its impact on our health. These are just the assumptions. We don't know what water may be called safe. And even if we are using this bottled water at home, we use our tap water to wash our glass utensils and drink this so-called pure water in the same glass. So we are assuming that the water that's coming to our tap might be safe for just using to wash our glass, but not safe for drinking. So there are many such type of things which normally we perceive that I think is not correct. The problem of water and its contamination is quite complex, and we can't judge that how this water or this is getting contaminated for a particular reason. There may be a number of reasons behind that. Especially the arsenic issue. You can say in 1995, the world has was working on 50 parts per billion arsenic level, and they were quite happy with that. But as the time passes, they have now set that level to 10 parts per billion, and our NEQS also adopted the same level of 10 parts per billion. But we need to see, we need to understand that the contamination that's coming to our water is definitely not good for our health, and we need to make sure that how to avoid this contamination and ensure that we are getting the safe drinking water. There are a number of questions regarding the technologies. The filtration plants, those were installed in the earlier stages as CDWI and CDWA and other projects. Initially, there were some issues with the plants were installed, but there were issues in the operation and the maintenance areas. For that reason, those, we could not get the required outcome, expected outcome from those plants. Although the process is quite slow, and our company last year also finalized most of the projects, but for some reasons we are again going through this process again. And as I mentioned in my presentation that up to 2019 we will cover about 18 more test seals, and it will, I think it may cover about 40% of our target area in the up to 2019. So this will be, I think, a huge achievement, and as I have also already said, sorry that we did not come up to the expectation, but we are not trying hard, and for that reason, our company is now working in two parts: Saaf Pani Company North and South. But there are issues regarding just as someone pointed out that there are issues in the developing interest in the investors and the contractors like that. Everybody understands that the working scenario in our country, and nobody tried to take extra risk for these things. But we have made sufficient efforts to motivate all the major key players to come and contribute and try to put their join hands with us for this noble cause.
So we'll have to cut you off at this point, and we're running very late. Dr. Hassan, if you have 1 minute.
So the 100% figure is for Lahore, and the health outcome study is for entire Pakistan using Joel Podgorski's data set. So if you want to talk to me about that in detail, you can do that. Mahmood साहब ने point out किया था that we already see willingness to pay when we see people buying water outside. Probably there is some difference between an informed consumer and an uninformed consumer. So, but there are like several already done willingness to pay studies. Everyone finds the result that there is willingness to pay for clean water. So probably there is no, there should not be any apprehension while raising the tariffs. So, और मैडम ने पूछा था कि क्या एक मेजर होना चाहिए. So मेरे ख्याल में कोई भी ऐसा मेजर आप लोगों को आज से ये नहीं कह सकते कि आप पानी पीना बंद कर दें. But for being an economist, I would say price that commodity according to its value so that you start conserving from today. That would be the first step I would suggest. Thank you.
Thank you very much. I'm sorry to have rushed all the speakers, and thank you very much for your patience. Please, there's a cup of tea and join us and continue your discussions on an individual basis. Thank you.